All right, I'm going to pass this on over to Sam, and she is going to introduce Dr. Shannon Smith for the second portion of our afternoon session today.
Yes, well, thank you, Dr. Zhang. That was a really wonderful presentation. And next we have Dr. Shannon Smith, who constantly reminded me while I was going sick that it wasn't my forever. And even though every time I looked at him and I said this felt like forever, I just owe my health, so much of my health to him, and my mental health as well, because he always reminded me, this isn't your forever. And that has stuck with me, and I've tried to pass that on as well. He's a wonderfully smart and caring doctor. I really aspire to be a health professional like him someday. And a little bit about him, Dr. Smith specializes in functional medicine, autoimmune support. He is one of only a few doctors of chiropractic to be invited to MedMaps certification, Medical Academy of Pediatric Special Needs, and specializing in autism spectrum support and evaluation. He has attended over 660 postgraduate hours of nutritional training, Lyme disease training, and more, many under Dr. Turnpaugh. He wholeheartedly embraces this philosophy with his nutritional and functional medicine patients as well. And as you can see, he does his job pretty well, and I am living proof of that. So I'm excited to see your presentation. Thank you, Dr. Smith.
That was great. Can you hear me?
Great. Sure can.
Okay, so I'm going to share my slides. Can you see that?
Yep, we see it just fine.
Okay, good. Well, first and foremost, I've been listening all morning, and what great presentations, and kudos to you, Carrie, and to all the board members for TikTok, Heather. I know Dr. Chris at Turnpaugh is also a member, and it's such a pleasure to be part of this journey that we're all on to try and have answers for our patients. Not that we have all the right ones, but we're certainly endeavoring to kind of move forward with all of that. And great lecture, Dr. Zhang. The approach that I wanted to take today, and it was a really, really great segue for what Dr. Zhang just approached, with all of our patients, however they present to the office, whether it's acute or chronic, the differing approaches that we need to take is certainly multifactorial, because everybody presents differently, and the immune response that happens as a result of that is different in every individual. So in coming up with a topic for today, I didn't know which way I wanted to go with that, but my thought and process was to talk about our core basic premise on all of our patients in immune recovery and mitochondrial biogenesis in Lyme and chronic illness. And what we're talking about now in turning off the alarm stage, or that fight and flight stage in our patients. And certainly it's difficult, but it's what we need to do to have patients kind of move forward. What I'm not going to talk about too much, and certainly Dr. Zhang talked about, is our combination approach with the medical providers that are in our clinic that talk about, or that we approach with the antibiotic approach. And Dr. Zhang, we've actually been utilizing that triple antibiotic approach cohesively with our patients, including the dapsone therapy, and it's been impressive. We've also started to introduce, the medical docs have also started to introduce the disulfiram with some pretty good success, along with the Septin and the doxy. So we tend to do that multi-antibiotic approach collectively with the holistic approach that we're going to talk a bit more about. So with all that being said, let's kind of begin. Disclaimer, I am a chiropractor. I don't pretend to be a medical doctor. I've moved into functional medicine quite a long time ago for multiple reasons. The main one is that I've had patients that over time, you see them on and off again, that came into your office or my office that had different conditions, and you just wanted to be the one to help them. So you go down these rabbit holes with them and try to be the one to give them some answers. So over time, I've moved more into functional medicine and nutrition as a way to help my patients. And then you end up going down these paths, and many people ask me how I ended up at Turnpaugh Health and Wellness Clinic in Mechanicsburg from my office in Pittsburgh. And I just say, God put me on a journey, and I kind of ended up here. And certainly the journey is still ongoing. But over the course of time, I've tried my best to do anything that I can to help my patients. So with that in mind, what we're going to talk about today is the review of an immune regulation response from chronic stressors and chronic stress responses. And, what I try and tell patients all the time, it's not just this infection, which is certainly important to eradicate, whether it's an acute form or a persistent form, but it's the response of your own immune system that we have to look at and how to help that body's response kind of regulate itself. So the review of that immune regulation from a chronic stress standpoint, we're going to talk about. And then the end result of that that we're finding on a lot of our patients is a mitochondrial dysfunction that happens in the background of all of this. Mitochondrial dysfunction, and for those that don't know, mitochondria is in every single cell of your body, and it's there to make energy for us. So we see all the time that a lot of our Lyme patients just don't have any energy, or they have a failure to make energy on an ongoing basis. They can barely walk up and down the steps, or barely live their lives. So what we're looking at is this underlying alarm triggering mechanism that says to the brain, or the brain says to the body, that we want to stay in this fight and flight response. And so certainly we need to encourage the body to not have that response all the time and go back into a homeostasis and a rest and repair. So we're going to talk about that. We're going to talk about the energy production versus a chronic fatigue standpoint in Lyme, and really in any chronic disease. Then also talk about the master regulator for this mitochondrial recovery and steps that you can take that you can do on your own, that are fairly easy to do, that you can just use baby steps and do, as well as some other supplements and things, and then some therapies that we use in our office and our clinic as to why and how that they can help individual patients moving forward. Excuse me. Okay, now I'm stuck. There we go. Can you all still hear me, I hope?
Yes, we can. You're doing great.
Okay, so, Lyme, as we all know, is a multi-symptomatic disease. It presents in so many different ways. And I want, putting this up here, I just wanted to recognize that there's never really one symptom that isn't kind of immune to this illness. I always talk, when I do lectures to other chiropractors in the state of Pennsylvania, I always say the most unique presentation that I've ever had was a gentleman that came in that had erectile dysfunction, zero other symptoms, specifically any of the common ones for Lyme disease, except for his erectile dysfunction. And, obviously we tested him for Lyme as well as other things, and he was positive. And so, his symptomatology certainly didn't present itself as the classic forms of Lyme disease. So there's no symptom that I see that is immune to having an underlying Lyme thing. So when patients present, I don't necessarily want to be predisposed or precluded to say that they all have Lyme disease, but in Pennsylvania, since we're the #1 state in the last few years running that's had new cases of Lyme, we have to have that as our top differential to just basically roll it out. So not only are we testing for Borrelia, but we're testing for all the co-infections too. But as you all know, that there's many, many symptoms that can happen. And what we're finding, and Dr. Zhang kind of talked about that right before me as well, that these persistent post-treatment Lyme disease syndrome cases we're seeing quite significantly. Our goal is to get people back to their lives, not necessarily just to kind of treat their symptoms ongoing. So, the big question that we have is these different symptoms that people have presenting: fatigue, widespread pain, fevers, chills, sleep disturbances, which we're seeing a ton of insomnia as a primary ongoing problem for patients. Neurocognitive are so diverse as well, but we're seeing quite a frequent amount of patients with confusion and short and long-term memory, concentration, focus, and things of that nature. And then certainly depressive symptoms, whether it's specifically from the brain inflammatory response from Lyme, or simply that patients obviously get depressed when there's 4 weeks to 3 months to 6 months to years worth of problems. So certainly we want to look at these and try to get to the underlying cause of the problem. So my chiropractic brain always jumps in here and says, basically understanding the underlying cause of the problem, symptoms of chronic Lyme disease becomes challenging, multifactorial, but we don't really want to just treat your symptoms. We want to find out the cause. If the cause is persistent Lyme disease, we certainly need to help you change that antibiotic approach. to allow for that eradication or lessening of that infection. But the other approach is the health of the host. And what we kind of miss oftentimes is talking about the immune regulation and that immune response. So that's kind of where we really try to have our focus, is that aspect of the health of the individual and how can we help you recover your health. So the questions that often are asked the most are, why do some patients recover with antibiotics and others don't? I know Dr. Zhang talked a lot about that, and it gives us a good example about that. But ultimately, there's the individual's immune system that we have to talk about as well. Why do patients need continued antibiotics to feel functional and others don't? I'm a big proponent of trying to get the patients to understand that this is not a great idea. There's long-term implications of long-term implications of what it can do to your body with these long-term antibiotics. And I understand that when people try to get off of them, they don't feel that much, or they don't feel better, and they kind of go backwards. But our goal is ultimately to get patients' health and wellness to recover so they don't need them. So we're looking at that. Why do some patients' symptoms never fully recover? So we have patients that come in that have done all these treatments, persistent antibiotics or persister antibiotics, biofilm disruptors, gut permeability recovery, immune regulation, and they still have these waxing and waning symptoms. And certainly we don't have all the answers for these, but that's what we're looking for. And we have other options that we've seen some success with for patients that are still looking for answers. Are patients having ongoing symptoms from an infection standpoint or from the immune reaction to the infection? This is by far the number one question that I ask myself on a daily basis for every single patient that comes in, because it certainly has to be answered. Not that we can always have that answer quickly, but is the infection reactivating or has never fully gone away? Or is the result of the infection so stressful to the system that the immune system has a shift into what's called a Th1, Th2 shift, which we'll get into, that is now causing the ongoing alarm. So the alarm signaling, which we'll talk about, is either from an infection standpoint, your body's immune system standpoint, or the results of both of those things happening. So we'll talk about that a lot, hopefully in a little bit. Why, after treating the infection and even supporting the health and immune system of the patient, are your symptoms continuing? And again, this is a question that I guess all of us want to have figured out quickly, but that's where we're always trying to work with patients as well. So what we do need to remember, and I talk about this with patients all the time, is the health of each patient at the time of your infection, prior health history, your genetics, the length of time before you were diagnosed, the amount and types of infection that you received, and the proper treatment all matter. So nobody's perfectly healthy when they get bit by a tick, and your past experiences and or your life and your history and your genetics matter. But really the state of inflammatory response and immune control when you got sick definitely plays a part in how well you can recover. So we look at all of that and try our best to, tailor our treatment for each individual patient based upon that understanding. So this is a really interesting slide that I use in a lot of my seminars, but I know it's from 2015, but it gives really good insight. So the new insights to Lyme disease, but basically the summary is this disease can lead to heart conditions, neurological disorders, and inflammatory disorders, but really it suggests that there's oxidative stress and interrupted intracellular communication that may ultimately contribute to a condition of what's called mitochondrial dysfunction in the immune cells of Lyme borreliosis patients. These three things have been classically understood that Lyme disease causes this immune dysregulation for what we term a Th1, Th shift. For those of you who don't know, that we're going to get into that in a minute. A mitochondrial dysfunction, you have an inability or decreased ability, I should say, of making healthy or a proper amount of energy. And people have that struggling mechanism for quite a while afterwards, unless it's, we can restore that. And then the end result is oxidative stress, where the really easy way to explain that is just people don't feel good, things don't work right, they feel like they're aging more rapidly, or they feel like they're older than what they are. Definitely something that we see all the time, or we hear all the time. All right, so hopefully this isn't too confusing, and I'm sure a lot of you hopefully have seen this to some extent. This is Dr. Turnpaugh's immune cell differentiation pathway. We always say that this is our life on a piece of paper. So let me kind of walk you through this. So to the immune system, when there's a presentation or an antigenic presentation, this is called an APC cell. So an antigen can be an infection like Lyme disease, a bacteria, a fungus. It can be a heavy metal. It can be other forms of toxins. It can be an emotional stress overload, a physical stress overload, PTSD. Your own immune system can kind of trigger these things. So basically, an antigen is something that's presenting to the immune system where the immune system has to deal with it and figure out what to do. The immune system identifies a naive T cell, which has to grow up to be something else. We want it to grow up to be what's called a regulatory immune system cell, which is called, basically, we want it to be regulated, that it deals with it naturally. If you picture this kind of as a stress bucket right here, and then this is your seesaw. So this line right here would be like a seesaw. We don't want this to be tipped into a dominant situation. So when that gets stuck in what's called a Th2 dominance, then the immune system starts to have that signaling mechanism where it starts to get into an acceleration, and then it ends up driving these things down here. So you've heard in this whole COVID-19 conversation that there's a cytokine storm. And cytokines are chemical messengers for pain and inflammation in our bodies, but we don't want that to be accelerated and or stay stuck on, because then it leads to this tissue inflammation, tissue breakdown, and then certainly starts to cause symptoms ongoing for patients. So when we have a regulatory function and the healthy balance between these, then your body doesn't have this cytokine escalation and then a poor inflammatory response, or excuse me, I'm sorry, a poor circulatory response, and then chronic inflammation, which then all three of those then drive a lot of these issues for patients. When we see this Th2 response, what this means with the body, this is an allergy dominance that starts to happen. So for quite a few, if not all of our Lyme patients, as you have this Th2 shift, you become hyperreactive or hyperallergenic over time. So we classically see people come in and comment that over time, they're starting to become more allergic to their foods. They start having more allergy reactions. And this is a strong reason why we encourage patients to stay off of gluten, dairy, eggs, and then other foods that we look into to see if they're having reactions to, because after a while, when you have this shift from either the infection still not going away because of the antigen still there, or your immune system is kind of in that high fight and flight response to protect us, you become more and more allergenic. And unfortunately, every time you eat your bagel, egg, and cheese sandwich in the morning, you tell your brain that there's another infection coming or an inflammatory, gives it a reason for that inflammatory trigger. And of course, we don't want that. When we have that constant trigger, there's an alarm that goes off or a fight and flight that goes off with these cytokine cascades, and you're telling your body to drive more symptoms. So there's a strong reason why we have patients say you need to really look into those allergies. We do a ton of food allergy testing, heavy metal testing, things like that, to see if that's still kind of turning that signal on so that we can then down-regulate that and allow for healthy regulation and healing. The other thing that starts to happen when we have this Th1, Th2 shift, this side of the immune system is there for our bodies to go after the infection. And then there's a natural killer cell response that helps to fight the infection. Lyme loves to dysregulate this because it doesn't want us to be effectively able to get rid of it, and or the infection starts to hide in the biofilm and becomes a persister. So we start to see this reduce as this goes up. When we start seeing a Th1 reduction, we start to see an inhibitory effect against this part of the immune system naturally. But as this goes down, this inhibition goes away and we start to see more of a dominance. So healthy immune regulation is this working well, but in Lyme disease, it suppresses this and starts to cause a dominance, which has a trickle effect over into then stimulating Th17, which this is our body's inflammatory signaling to drive autoimmune diseases and cancers. So Dr. Zhang talked about that autoimmune trigger mechanism in patients with rheumatoid arthritis. And we see it frequently with not just rheumatoid arthritis, but with other autoimmune signaling that turns on with Lyme disease in this kind of an autoimmune state. The other thing that we need to be cognizant of, and we look at this all the time with patients, is the gut barrier and the leaky gut syndrome, whether it was there before you got infected or if the infection starts to permeate it. But this can be a constant underlying signal as an antigen presentation or as a trigger mechanism to drive us. So we're constantly recovering patients' digestive tracts and digestive functions as a means to help them calm down this signaling mechanism. Let's go to the next slide. So hopefully that makes sense. And so this is a slide that I've created from that one to hopefully make it a little bit more maybe eye appealing or whatever for patients. So this is a representation of stressors that are in the system that maybe get overloaded. So any stress that's just not emotional stressors can then overload the system. So gluten and dairy or other foods, viral infections, bacterial, fungal, and mold, any type of a physical stressor, chemical sleep that would overload the system. When you overload, that alarm mechanism starts to turn on, and then you get into what's called a cell danger response, which is Dr. Navio's work that I've looked into. We've looked into quite extensively, but we'll get into that in a minute. But that cell danger response, or the fight-flight response that starts to continue to go, or that continues to go on, then drives all those signaling we just went over. So the pain signaling, poor circulation, patients will come in and say they have brain fog, they've got poor memory, the cold hands, cold feet. You see definitely peripheral vascular problems in patients. You get an immune dysregulation, and then of course the low energy function that we see patients with. So what we try and talk about is reducing stress effect. Obviously the biggest stress reducer is to get rid of the infection. However, when that becomes challenging, whether it's persistent or the body's, you can't fully eradicate the actual spirochete itself, we have to look at other ways we can reduce the stress effect. Certainly reducing your stressors that are healthy are all of these things down here. Anything that you can do to reduce your stress effect is certainly going to help you get out of that fight and flight and allow your body to get into rest and repair, which then helps you regulate this response and move you into a state of function and improvement. Unfortunately, we have poor stress coping skills, including alcohol and sugar, high fructose corn syrup, tobacco, and other drugs and medications that might help us calm our brains down and calm our stress down, but unfortunately they add to the stress. So of course we don't want to use these as much as we'd want to use these. So the overload and the alarm signaling is a really a big component that we have. In this conversation, every single Lyme patient that we have, we need to determine if there's a continued infection and or a failure of the immune system and mitochondrial recovery, or of course both of these situations, the infection and then the immune mitochondrial balance. And I know that's very challenging because certainly everybody's different with that. These acute and then often chronic states continue what's the cellular immune response to fight the unresolved infection, or due to the inability for the body to resolve the alarm phase, continuing the cell danger response. When the alarm continues to go off, your body stays stuck in that fight and flight, and it doesn't get into rest and repair, and it's hard for the body to then get into a recovery situation. The immune dysregulation and or suppression over time causes further mitochondrial dysfunction, leading to ongoing symptoms and then further oxidative stress. People get stuck in that post-disease Lyme disease, or PTLDS, post-treatment Lyme syndrome, or I don't feel good no matter what I'm trying to do. So we're trying to get people obviously out of that cycle, and everybody reacts differently to that. So this is a shout out to Dr. Navio's work about how diseases arise from the body's response to environmental stressors. He talks about environmental triggers ringing the same bell. Obviously, we've adapted that to certainly the toxic approach or the infection approach, but any stressor will start to kind of turn that alarm on and ring the same bell to elicit that cell danger response. When the cell danger response persists abnormally, whether it's from a persistent infection or from the immune dysregulation, the whole body's metabolism and the gut microbiome are disturbed. The collective performance of this multiple organ system is impaired. Behavior is changed, and then chronic disease results. That's Dr. Navio's statement. So the way that I explain this to patients is that alarm mechanism, when it's constantly signaling in the background as a chronic danger response, immune suppression starts to happen. So your body has that poor immune regulation, Th1, Th2 shift. You get an elevation of the inflammation and or cytokines that stay persistent. And then certainly can wax and wane depending upon your life. So we've often see patients come in and say, well, I do the same thing every day. I eat the same thing every day, but yet there's days I feel good and there's days I feel bad. Ultimately it's the expression of the stress response and what you can handle during the day and what you can't. So when your bucket's overloaded and it causes more inflammation that day, then you'll feel symptoms. But if you slept better, you maybe did a small amount of exercise that day and it helped your body calm down compared to the days before. That's why sometimes that there's expressions of inflammation some days compared to the others. The reduced blood supply to the system starts to happen. You get poor circulation, peripheral vascularization or circulation into the capillaries becomes a little restricted. It can lead to poor brain function when you have poor oxygenation and blood flow to the brain. And or poor nutrient function to the brain. So that's part of what we see that leads to the brain fog and confusion and memory loss and things like that. So we've got techniques that we've tried that have been successful with patients to help that oxygenation of the brain and circulation. There's also, arguably the hormonal shift, thyroid shift. We talk about it's called the HPA, HPT, HPG axes. This is the adrenal thyroid hormonal relationship that we see in patients. I'm not going to talk about this too much, but basically this is the brain's control over stress. At some point you get really exhausted because all you're doing is trying to fight the stress response. The adrenal glands are there to help us manage stress, and they get weakened. They kind of go they look like a grape and they get weakened to a raisin. And so as they get weaker and weaker, your body starts to recruit hormones and then thyroid function to try and compensate for that ongoing stress response. And so we'll start seeing presentations with patients with all three of these different areas. And so certainly that needs to be looked at in the beginning with a lot of our blood work that we do in our extensive blood work to try and see where we need to start. So we'll oftentimes see a thyroid shift and a hormonal shift in patients with these chronic situations, and sometimes even acutely, and that might be a stumbling block or roadblock for your ability to kind of recover or get better or get into that rest and repair phase. We're going to talk a lot about mitochondrial dysfunction and then the signaling mechanism of the PGC1 alpha in a minute, but this is the master controller of the mitochondria to help that recovery. When these are constantly going off and constantly in dysregulation, then all these other symptoms can start to pop up for patients. So, addictive properties, mental health can be a big component. Cancer, Alzheimer's, dementia, chronic fatigue, Lyme disease certainly can kind of drive this, but anything that dysregulates the immune system, not necessarily just Lyme disease, can be in the background in driving this. We see a lot of autoimmune disease patients and a lot of cardiovascular patients, but our goal ultimately is to try and figure out what's driving the symptoms, not just to treat them, the symptoms wise. So this is what your mitochondria looks like. This is the energy producing factory of your cell in every cell of your body. So that's what the cell looks like. There's the mitochondria that has mitochondria DNA. Just a brief thing about mitochondria and their function. As you may know, it's responsible for producing 90% of our energy. When you don't have a lot of the numbers when you have low mitochondria number and or low function, then you've got low energy, makes sense. High numbers has high energy, and then you have better vitality and better health and better anti-aging. This explains why mitochondrial dysfunction is the primary cause of age-related decline. So when we have patients that come in for Alzheimer's disease, this is a big component of what we look at to try and help them recover, but anything that reduces mitochondrial dysfunction in numbers starts to cause the patient to not feel good. So what I want to explain with this slide is that when you have mitochondrial dysfunction, here's the mitochondria, and a huge majority of your ability to make energy is inside the mitochondria. The other aspect of making energy is outside the mitochondria called glycolysis. So you eat food, you add oxygen, and that when you have food and oxygen, it equals ATP or energy, and then it comes off as CO2 and carbon dioxide, which I didn't put on here. But when people have these situations where there's a massive fight-flight response that goes on, in acute stages, people get stuck or go into a glycolysis as a means of quick burning energy. So if you have that proverbial running from a tiger concept in your mind, and you start running down the street as fast as you possibly can, you need a ton of energy to do that. And so glycolysis is a really quick way to do that, but it's very inefficient. The problem is when the tiger never goes away because it's Lyme disease or some kind of an underlying issue, people start having problems with full energy production because you're not efficiently utilizing every aspect of breaking down glucose or food to energy. So you start losing the ability. So mitochondrial dysfunction, one of the things that happens is you have poor translation of this glycolysis aspect into this oxidative phosphorylation, it's called, to make energy. So we start seeing a very, very deficient energy production with patients. So our goal ultimately is to reverse this. And there's many different ways that we've seen success in doing this. The best way is when you get rid of the infection early enough and the body itself goes into a rest and repair, and this kind of just resets itself naturally, which is unbelievable. However, when we have patients that doesn't necessarily do that, for either because the infection's still there, or again, that immune dysregulation is still there with that Th1, Th2 shift, then we have to continue to dig into the reasons why, continue to dig into the different rocks in your bucket that would potentially be still there overloading your system and cause the body to stay stuck in a preservation and self-preservation in a fight and flight mode. So that's one of the big reasons why people, with Lyme disease and or chronic infection have that problem with constant energy deficiencies. So during an acute injury or infection, mitochondria will reduce their activity to lower levels, mimicking a hibernation response. Glycolysis takes over as an emergency fight-flight supply for energy. This provides very quick energy, but with minimal cellular effort. When this danger of the infection is gone, the cellular healing begins, and the mitochondria increase function, producing optimal energy, and thus coming out of hibernation. Even though glycolysis, that outside part, provides quick energy, the other steps inside the mitochondria called oxidative phosphorylation and the Krebs cycle produce exceedingly more energy, especially needed for healing and repair. So, the ongoing recovery aspect is very energy dependent as well as going after the infection, and all that ATP and energy is needed. So in Lyme disease, many patients stay stuck in this glycolysis due to the ongoing mitochondrial danger signaling, representing the continued infection or the imbalance in the immune system, or maybe even both. From what Dr. Zhang talked about, the persisters would make a whole heck of a lot of sense in doing this danger signaling. The result is slow or poor healing, ongoing fatigue, weakened adrenals due to the continued fight and flight signaling, a shift in the immune system to that Th2 dominance, otherwise known as allergy escalations, all leading to chronic disease, chronic fatigue, and or chronic Lyme symptoms. So our approach is in our PTLD as patients is trying to figure out if there's a combination between the infection not resolving or the body not resolving its own immune dysregulation and mitochondrial dysfunction, so that alarm signaling. We got to turn the alarm off so that we can get back into that rest and repair. So an easy equation, I guess, chronic Lyme equals chronic immune imbalance, which equals mitochondrial dysfunction, and then chronic disease. So with that being said, how can we help? What do we need to look at to get this under control, to try to improve this function? So PGC1 alpha is the master regulator of this mitochondrial recovery, and what's now is what's termed biogenesis, or making more mitochondria, or the ability for your body to have better mitochondrial function. That's the name of it. It's called a peroxisome proliferator activator receptor gamma coactivator 1 alpha. It's 5 times fast. It's also easily called PPR gamma gene coactivator 1. So it's the PGC1 alpha, easier way to say that. It's very important in energy production, fat metabolism, weight loss, blood pressure, cholesterol homeostasis, detoxification, sleep patterns, and anything really to help with an anti-aging. So I showed this to Dr. Turnpaugh, and he said this is a lot on one slide, so please don't get too overwhelmed. We're going to kind of go through this as a general approach. So here's PGC1 alpha, and there's 5 pathways that you can utilize, or we can look at individualizing patients' care to see what's best for them to maybe help them. Now, unfortunately, there's no testing specifically to say that we need to do maybe this pathway or this pathway on you individually. However, this is why we've seen some differing effects with some of the therapies that we utilize in our office, and to differing effects on patients. So with, let's start over here at this pathway. This is a pathway that's very much stimulated by sugar and insulin surges. So patients that have this dominant pathway that might be inhibiting this PGC1 alpha recovery, when you don't have this working or you have this inhibition, sugar would cause very, very bad outcomes for these patients. So patients in this pathway with changing their diet to a low glycemic or a ketogenic diet is actually very, very helpful. The other way that this pathway is very stimulated is intermittent fasting, and then hyperbaric oxygen therapy has been very, very helpful with these patients as well. That's also another reason why when you do hyperbaric on some Lyme patients that they don't have any effect, because arguably this pathway isn't their dominant pathway. Photobiomodulation light therapy we've started to utilize in the office. It's a red light therapy that's actually helpful to stimulate many of these pathways as well. But that's been very successful in some of our patients as a conjunctive adjunct to their therapy. Supplements, these are the supplements that are the most effective in helping this as well. For those of you that haven't ever used molecular hydrogen, it's a great way to kind of stimulate this pathway as well. We have a supplement called H2 Absorb from Research Nutritionals, who's one of the sponsors for Sam Spoons, but that's a really great way to do this, to stimulate this pathway. This pathway and the AMP kinase pathway are the two pathways, the SIRT1 and the AMPK pathway are the two pathways that look like they're the more dominant ones for patients. So in our office, we do a lot of NAD IV therapy, nicotinamide therapy, or the B vitamin. It's from a thiamine B vitamin therapy that's been very, very helpful to stimulate this, which I'll go into in a minute. And then calorie restriction. For those of you who haven't done this, this is helpful in a lot of our patients. The calorie restriction and or the intermittent fasting can actually help to reset these pathways to then calm down the brain's response and give your body an ability to reset that ability for the mitochondrial biogenesis and kind of turn the tide for that recovery. As you can see, all 4 of these pathways are massively increased with exercise. The problem with that is those of you that really have so much fatigue that you can't exercise to a certain point, and you feel that there's always a level where you go too far and then it throws you back into the alarm phase or the fight and flight. So what we try to encourage all of our patients to do is exercise to tolerance and do the best that you can, but you can't go too far too quick, because then you go back into that alarm signaling and then you're going backwards. So I love using this slide for patients to say, look, you've got to do something. You've got to try somewhere and somehow to do this. And I know with Sam's therapy, she used underwater treadmill therapy as a means to initiate this, because she could barely even walk, let alone tell her to go on a treadmill. But underwater hydrotherapy was very integral in helping her recover. And it's interesting because what you're starting to do is you're initially signaling that PGC1 pathway to tell your body to help and increase energy production and then heal, but when you really have a hard time, kind of pushing yourself. So the biggest and best outcomes are the patients that we can then, slowly move into more exercise without them overloading is really where I've seen the most success with patients. Now, of course, that's difficult. I get that, but don't give up your exercise and don't give up your hope to exercise. Just put one foot in front of the other and do the best you can. Even if it's 5 steps up and down, and then the next day you can go to do 6 steps up and down your steps. It's just something you've got to try and do every day, but you can't push too quick or too much. You can see these other pathways. I'm not going to go into all of them specifically, but the one that I really want to talk about as well is this pathway for oxidative stress. So remember that slide we had before we talk about Lyme disease being an immune problem, a mitochondrial problem, and then certainly an oxidative stress problem. So the mitochondria really don't do well when there's a ton of oxidative stress. We use a lot of supplements to really help reduce oxidative stress. These are just different ones that we've tried, and obviously that patients' response to them are certainly different. But we have to put them on some level of oxidative stress reduction. We use a ton of glutathione and N-acetylcysteine to help that mechanism. We have had some really good success with our photobiomodulation, our light therapy, and then we have an anionic foot bath that's been helpful as well for patients. And some patients feel that really, really has changed the tide for them as well. I think that's pretty much all I really wanted to go over with this. These kind of correlate to the different pathways as to our focus. This is not certainly limited to or has everything in here. This is kind of an ongoing sliding scale that we're adding to and maybe even taking away from on an ongoing basis. But it's a really good roadmap for patients, as well as actually for me to try and remember the different things that we can kind of do. But I'm always changing and adapting this to make sure that we're on the right track for as much as we can be for ongoing patient improvement. So that's PGC1 alpha and its control and mechanism for that signaling. I wanted to show this slide, literature review on the two different pathways, the SIRT1 pathway and how it drives inflammation. But this is closely linked to an immune-associated diseases, including infections, tumors, allergy, airways, inflammation, and then autoimmune diseases. So the basic gist of this slide would be, I wanted to show that signaling, that main signal mechanism, the SIRT1 pathway, which, let me see if I can go backwards here, is this pathway here is the pretty much key in helping people increase not only NAD levels, but down-regulating this activity in the brain to calm down and not drive autoimmune diseases. So again, it's that regulatory balance that starts to happen with patients. It's crucial in controlling the immune-associated diseases, but that immune regulation as well. So coming down to the kind of the end of my slides, and then certainly answering some questions would be more fun for me. But mitochondrial dysfunction is in the background of a lot of different underlying ailments, including Lyme disease. But all these other conditions, we certainly need to have this kind of a process or understanding when patients come in. This is our understanding to start with. So, I've been doing and treating and supporting rather patients with autoimmune diseases for quite a long time. And it's really done well for our Lyme patients as well as all these other patients that we've seen as well. But ultimately, we want to look at the health of the host and recovering that immune dysregulation, the resultant mitochondrial dysfunction or energy production, and then we want to get rid of as much oxidative stress as we can. So to summarize our treatment that we look at, that's been helpful for those of you that haven't looked into any of these, NAD or nicotinamide adenine dinucleotide treatment. IV NAD has been a game changer for us for so many patients to get them out of the fight and flight and really, really help promote the SIRT1 pathway, this one, which is the dominant pathway, to encourage the brain and the body to want to increase healing and recovery into the fight and get out of fight and flight. It's been unbelievable on how well patients have done with this. The challenge is we've had patients that don't do well with this. Thankfully, only a small percentage, but we're working through that. And we're trying to figure out why some people maybe genetically or just their body isn't ready to accept this kind of a push or a nudge to that immune recovery. But most people have done really, really well with this. We have a Juve light in our office now, which is really exciting. It's a full body light therapy. It's far and near infrared, but mainly it's red light therapy. Red light therapy is impressive because it gives you what's called a photobiomodulation. So I know I used that word before, but basically what it means is that you have this red light specific wavelength that can penetrate into the tissues, specifically into the mitochondria, and stimulate mitochondrial biogenesis or mitochondrial function. A couple of the things that I wanted to highlight from this slide is that it increases these neurotropic factors. Growth factor is stimulated, and then brain-derived neurotropic factor. And all these growth factors are really needed when you increase the neurotrophins to stimulate brain energy, brain recovery, so neural recovery, and especially with not only just with Lyme neuroborreliosis, but in patients that have any type of a Lyme condition, it's extremely effective in helping the cognitive aspect and the recovery. It also increases blood flow to the brain. So we talked a little bit before about the poor circulation that can happen when the immune system is dysregulated. So it helps to modulate that and increases angiogenesis. It increases growth of new blood vessels. And then it's also a very strong antioxidant for the brain and anti-inflammatory, which certainly contribute to some of these problems ongoing for people. This is a, oops, I'm sorry. Oh, okay. This is a research study that talks about photobiomodulation and how it helps with hypoxia and ischemia injury. But what I wanted to show is how the photobiomodulation or the red light therapy helps to reduce mitochondrial dysfunction, reduces oxidative stress, and helps to reduce the injury neuronally and allows the body to start to recover. A great slide to show the penetration of the red light into the mitochondria to help that signaling mechanism for healing and recovery. We also use hyperbaric oxygen therapy. We've had some really fantastic recovery stories of some of our patients. One patient coming to mind that had, I believe he had 5 years of daily migraines with his chronic Lyme. And I think it was after the second session of his hyperbaric therapy, his migraines had completely resolved, and knock on wood to this day. And it's been about 6 months, maybe 6.5 months. He hasn't had a migraine. I think I take that back. He's had 2 migraines in 6 months, which I think is a whole heck of a lot better than daily. But he's doing phenomenal. Not only that, but he had, he was walking in with a cane, and then he had a contracture with his hand, his right hand. And that's actually all resolved now. He doesn't need a cane. He's walking normally and his hand is functioning normally. So forcing vascular perfusion to those patients that have that as their primary, or maybe even to some degree, part of their problem has been very successful. Again, some people this doesn't work for at all. I know with Sam, it was a huge game changer for her as well. And she might be able to jump on and kind of explain that as well. We also do peptide therapy. Peptide therapy are signaling proteins that help the body and the brain do a little bit better signaling or better brain body function. So when you're in a fight and flight, if we can do anything that we to help the body signaling mechanisms, there's so many different peptides. If for those that haven't looked into this, it's actually been, again, another game changer for patients. The ones that we use the most are the ones that help with immune regulation. Certainly patients come in to try and do the weight loss, which I've got mixed opinions with, but the immune regulation and then the mitochondrial support has been really, really helpful for patients to get them unstuck. It's kind of the way that I explain that. And it's definitely for reducing inflammation. There's a lot of this in ALS patients and Parkinson's, but we're adapting that to more of our immune regulation or immune re-regulation approach. I got to throw a shout out to chiropractic because as a chiropractor, there's a lot of benefit that chiropractic care can have and does have on patients' health and wellness, not just to control pain, but it also improves health and sleep, stress, happiness, well-being, immune system function, strength, life, and mobility. What we say a lot is that if you move well, and you can move well, so patients with chronic back pain or hip pain, and you can't exercise, you can see the cascading effect that can have on restricting the body's ability to recover. So there's a strong correlation there. So of course, a shout out to chiropractors in gaining some function with Lyme patients. But we talked a little bit before about how important exercise is. Any little bit can help. Intermittent fasting and ketogenic diets have been very impressive and helpful for a good percentage of our Lyme patients, our chronic Lyme patients, as well as our autoimmune patients in general. For those that haven't looked into this, it's certainly something to look into. We talk about a 16-hour fast every day. So it's a 16-8, or what I say, if you want to be more strategic and a little bit more advanced, you can do an 18-6. So you fast for 18 hours and eat for 6 hours a day. So let's say noon to 6 p.m. every day is when you eat most of your food, and then don't eat the other day. So that body has to go into a ketogenic or a fat burning approach, which then calms down inflammation. And there's a lot of impressive studies out there that have shown how well that helps. So to summarize, the top 10 supplements that patients ask us all the time, what are the best ones that for Lyme disease in general, but these aren't specifically the ones that we use for just quote unquote Lyme or immune regulation, but these are the ones that are the best. Not that we put everybody on all of these for mitochondrial recovery. CoQ10, for those that don't know about CoQ10, it's for nervous system support, and it's needed when you take a statin because statins will block the body's ability to make this and digest it. Hypertension and smooth muscle transport it's needed for hypertension and smooth muscles. It transports hydrogen ions inside the mitochondria, essential for energy production. So it's extremely needed in anybody that doesn't have a lot of energy. It can be a game changer, and it certainly is in patients that they just have that deficiency. Magnesium is needed for muscle relaxation, hypertension, cardiac function, brain function, calming in the body. It's stored in mitochondria. It's needed for energy production in general. Magnesium glycinate is good. Magnesium malate is really good for brain. Citrate is more for digestive and constipation patients. Here's the nicotinamide riboside, NAD, but the nicotinamide riboside is the supplement form of NAD that we have in the office as well. It's derived again from niacin, which is a B vitamin, and it's extremely needed for complex 1 function of the ATP inside the mitochondria, which is the main part of energy production in the body. These levels will decline of nicotinamide riboside with aging and high stress conditions. So of course, Lyme disease is a massive stressor to the system in many ways. So patients can then have this massive depletion, which is why it's been a game changer for a lot of our chronic Lyme patients because of that depletion. Unfortunately, we've tried, or at least I've tried to test for that B1 level in blood chemistry, and there isn't really a correlation that I've seen that when you check B1 levels that you can see this being low. But you definitely, when we see these supplemental support and or the IV, it's definitely been a benefit for a lot of our patients. Creatine has been kind of a classic one for energy production. It's made in the liver, the kidney, and the pancreas, and it's shown to aid in muscle regeneration, mitochondrial regeneration, and anti-aging. It's a basic supplement, I think, in many of the just ATP or energy supplements, kind of like a multi-energy supplement. It's basically in a lot of them as well already. Alpha lipoic acid, this one's required to produce acetyl-CoA, which is very much needed to convert your carbohydrates into energy. Alpha lipoic acid is also a very strong antioxidant for mitochondria, so that one pathway for the mitochondrial increase or mitochondrial biogenesis, it's a really strong one for that. It competes at higher doses with biotin, so sometimes you need to co-supplement with biotin. The big thing with this one that we see a lot of is peripheral neuropathy, numbness and tingling into the extremities. At higher levels, typically around 1,500 to 1,800 milligrams, this tends to really be a game changer for a peripheral neuropathy patient for those higher levels specifically. PQQ is, it's called pyroquinone, high in cocoa powder. So for you chocolate lovers, low sugar, the high dark cocoa content is actually really helpful in giving this. Now, certainly, I'm not going to sit here and say that everybody needs to eat sugar, or excuse me, take dark chocolate or dark cocoa as this PQQ, but it does encourage mitochondrial growth. What it really does is it helps with mitochondrial recovery in the when patients have low cytosol content or low cytosol. But PQQ and also helps with short-term memory, anti-aging, and immune support. 20 milligrams a day has been shown to be the most effective dose. It's kind of a form of CoQ10, but a super CoQ10 is the way I explain it for patients. B vitamins in general are needed for so many different parts of that Krebs cycle, or the ability for you to make energy, but B6, B1, B2, B3 are all very, very important. So sometimes just taking a general B vitamin is really, really helpful. Sometimes we'll have to split them up and to give specific ones a higher level. L-carnitine is an amino acid that's derived from long-chain fatty acids for transport. Mitochondria is to be processed into energy. Dietary fats can't get into the mitochondria to be converted to energy without enough of this. So patients that are on ketogenic diets Sometimes need a little bit more carnitine to help, but you can get that actually from the, eating some protein. It also helps to clear lactic acid buildup after exercise. This is the typical dose that you'll see depending upon the patient. Resveratrol is starting to be, more and more looked at, but we're looking at it more kind of as a game changer at higher levels for some of our patients, especially the ones that couldn't handle the NAD IV therapy. We're putting this in higher levels, and it's been actually pretty impressive. But, this one is the main one for the anti-aging for that SIRT1 pathway, the primary pathway for mitochondrial biogenesis. It's also found in red wine and grapes and berries. So of course, red wine and dark chocolate, I know all of you are sitting back and saying that's what you're gonna have for dinner tonight, but resveratrol is really, really good for oxidative stress reduction and those free radicals, if you don't control them from an oxidative stress standpoint, can increase mitochondrial dysfunction and start to have some cellular damage. So resveratrol has been shown to be preventive for this. It's a very powerful antioxidant. And then this is typically the dose. We've been going a lot higher than that on a lot of our patients, and it's been showing to be a big promise. So kind of stay tuned for that on my next talk, I guess. D-ribose is a simple 5-carbon sugar. It's the most fundamental building block for ATP, and it's naturally found high in eggs, beef, dairy, but really not in high enough levels to boost your mitochondria. It's also been shown for healthy aging, and certainly with people that have heavy exercise will deplete that. We've used that in differing degrees, and we still consistently do. I haven't seen that be a game changer on a lot of our Lyme patients. The challenge is if you have allergies to any or all of these, and you start to reduce those to make sure that you don't trigger an allergy or an immune response, sometimes you might have to supplement because you're kind of diminishing some of that. So that's my presentation. Here's my lovely family. So from us to you, God bless, and I hope this helps and hopes it pushes you in a direction for your continued recovery, and it gives you ideas that you might not have thought about to help continue on your journey to recover. So from that, I'll send it back over to Heather.
Thanks so much, Dr. Shannon. Wow, so much great information shared there. We so appreciate it. And so we do have questions for you. So I hope you're ready for them.
Let me get back to my desktop so I can get out of this.
Yeah.
So if I get a little excited and talk fast, I hope it wasn't too fast.
No, it was perfect. And I'm going to go ahead and stop your sharing, and then we'll just have video.
Oh, there you go. Thank
you. Good. Yeah, absolutely. So I'm seeing some questions about, you mentioned something to help with oxygen to the brain. Can you elaborate on this? For years, I have felt I cannot get enough to my brain and suffer terrible brain fog, which I think many Lyme patients, the brain fog is one of the hardest things to get under control. So
there's a thing, and if it makes more sense, I can go back to one of my slides, but there's a thing called inducible nitric oxide that's actually increased in chronic inflammation. Let me go back to the slide. It might make it easier.
Sure.
Oh, we don't want that. I'm a big fan of pictures. Makes my life easier. Whoops, I'm too far. There we go. Okay, can you see that?
We can.
Okay. So this part right here, it's called inducible nitric oxide. And when this increases, the vascular function will tend to decrease. So anytime that there's a condition in the body where we have that shift, again, we call it a Th2 shift, Th1 suppression, inducible nitric oxides increased, cytokines are increased, inflammation and tissue breakdown are increased. And when this is increased, the ability for your body to have healthy vascular function becomes decreased. So this goes up, and these kind of go down. And when you have that go down, you also have neurological function go down. So this kind of is classic brain fog right here because of an inflammatory immune shift that would enable your body to not have this healthy balance right here. And things that can help this are things that would increase, let me get out of here, things that will increase healthy blood flow. Exercise can do that. And then if we also have supplements that certainly can help that. The one is called Nitric Balance, which has supplements in there to help increase blood flow to the brain and to the peripheral vascular tissues. I don't know how I get back over to my other slide. Can you get me back? There you go, thanks. Oops, now I can't hear you.
I'm muted, sorry.
Oh, there
that
we
happens
go.
once
Okay.
every call.
I'm challenged, computer challenged sometimes, so thank you.
Well, you don't want me doing any chiropractic care at anybody, so
I know, right?
let me do this
There you
part. I personally have a hard time distinguishing the inhibiting factor to increase physical activity. How do you determine if it's an energy production issue or a mitochondrial issue? And in looking at the PGCI-A pathway options, how does one identify which intervention should be tried first? As a patient, I'm always balancing trying treatment interventions with the amount of funds available. I think so.
Those are, yeah, great questions. I think, what I try to encourage patients is, especially with that PGC1 alpha pathway, the most dominant pathway that we're finding is the SIRT1 pathway. So exercise really helps that, and then intermittent fasting. But if you look at the slide, if you remember looking at the slide, exercise hits 4 of them. So anytime that we can increase exercise, it's always going to be helpful. But for the first part of the question, if you don't have any energy, it's really hard to exercise, I understand. So there's one test that we've been looking at, and we're kind of still on the whether it works or not stage, to being able to determine what part of the mitochondria is deficient on every individual patient. But other than that test, there's really no way other than just supporting the mitochondria and giving it nutrients, and then slowly encouraging your body to make more mitochondria and more energy production that way. So you kind of have to do both, supply nutrients to the mitochondria, and then go through, baby steps to slow activity and exercise, and then, maybe some calorie restriction. But those things are, exercise is free. So for, limited budgets and patients that have already spent thousands, we always try our best to do things or encourage you to do things that could be helpful at home. But, those are the things I try first with patients.
I can personally speak to that being a critical part of my son Logan's healing was movement, and he's actually is a movement practitioner. But that little whatever that is each day, whatever we can do.
And everybody
he crawled first before he could walk, right?
Exactly. Everybody starts different, right? So I guess the overwhelming feeling that I get from patients is they just get overwhelmed that they can only do 2 steps, or they can only do 1 flight of steps, and then they get somehow, somewhat demoralized because, like, oh my goodness, I could run marathons before, now I can only do half a flight of steps. You just have to then, Logan's conversation was completely different. Change your paradigm and say, it's not what I can't do, it's what I can do, and what I couldn't do yesterday, I can do different today. And you need to do 1 full set of steps, and then walk down the street, and then walk twice down the street, and go farther and further every day, and just be thankful that you can continue moving forward. So, yeah.
All right, just a few more questions, and then we're going to go to Dr. Rajatis. Does Bartonella have the same effect on the immune system, T1, T2 balance, NK cell, depression? Are those all things that you see with Bartonella as well?
All of the infections, no matter what they are, will do the same thing to the body and to that immune response. We've actually seen it in Candida patients, to a lesser extent, but any antigenic trigger will cause that shift. How much it shifts is dependent upon the individual and how well you can help regulate that immune system. But that's all differing. That becomes the different expression, but any one of the co-infections will do it too.
And thank you for that. And have you found viruses being unaddressed leads to chronic Lyme?
We check for chronic viral overloads or reactivation, especially Epstein-Barr. Health of the host matters most at the time of infection. So if somebody is battling a chronic underlying viral overload that they're unaware of, or even they are aware of, that definitely, kind of sets the stage. Do I think that, Epstein or like a viral load precludes somebody from having Lyme? Not necessarily, other than it can kind of suppress your immune system. And when you do get bit, or if you do get bit and your immune system's more susceptible, it might not have as good of an expression. I think I
Alright.
answered that question.
Yes, you did. Thank
Okay.
you. And I think this is one for everyone. Thank you for the presentation. It has broken down a lot of our struggles into possibly manageable segments. And so
Oh, that
thank
makes
you
me feel
so
great.
much, Dr.
I'm
Shannon.
always worried that it's going to be, too much information or necessarily maybe kind of goes a little too far, but I try my best to break it down so everybody can understand.
Well, we can't thank you enough for all the
Thank you
work
so
you
much.
do on a regular basis. Another question that I
Yep.
have from some of my Pennsylvania folks is, are you still taking patients? And will you take them
We're
on?
always taking patients.
Okay.
So we're taking patients in both Mechanicsburg and all of us, there's a bunch of us in Mechanicsburg, and then I'm kind of flying solo with the functional medicine in Pittsburgh. So yeah, I still take patients there, but only on Fridays. But yeah, my contact information's on the internet, and I know that Carrie has it too on Sam Spoon. So.
And the last question is, can we get copies of the slides? So what I will do is I will confirm with each presenter separately and let you know if they're comfortable sharing their slides.
Yeah.
What we will have is a recording of this available to you all. So you might not be able to get their slide presentations per se, but we will confirm with each presenter individually. And what we can send out, we'll send in a follow-up email to all of you because you registered for this. We have your emails to do that. So. All right.
Great.
Thank you so very much.
Thank you so much. Thanks for having me.
So last